Awesome. Welcome everyone to the November social work office hours. So we can use the chat if you guys have any questions, or feel free to come off mute, raise your hand during the presentations. They will probably wait until after their portions to answer questions, but definitely put them in the chat to make sure we don't miss anything. We will be uploading the slides and the recording to our SNF office hours website. So if you are not able to attend the meeting, or you just want to get a refresher later down the road, definitely feel free to go to that website. If you're listening by phone, press *6 to unmute or *9 to raise your hand. If you need closed captionings, or if you just want to use it, go ahead and click the CC button at the bottom. And then, like always, if you need any accommodations, please let us know by emailing our 504 ADA state email, and we will definitely try to accommodate the best we can. So we will go ahead and get started. Go ahead, and our agenda today, first we will start with Brooke Snyder, who is our Workforce and Sustainability Specialist here at the department. She will talk about rural provider sustainability resources. So we're really excited to hear from her. And then always, we will also hear about transition services from Janelle Poulier, who is our HCPF benefits specialist. And then we'll talk about future topics and some exciting things we have coming up for these meetings. Before Brooke jumps into it, if we could also have everyone put your name and the agency that you're with and your title in the chat, just so we can get a pulse of who is in attendance. If you don't mind doing that, that'd be great. Again, just your name, agency, and your title in the chat. Thank you for doing that, but we will go ahead and jump into it. So Brooke, take it away.
Perfect. Thank you, Samantha. Hello, everyone. My name is Brooke Snyder, and I'm the Workforce and Sustainability Specialist on the Direct Care Workforce team within the Office of Community Living here at Healthcare Policy and Financing. And I have a really exciting opportunity for engagement that we like to, and a very friendly cat that would really like to be a part of this meeting. A really exciting opportunity for folks to be able to engage with other rural providers, care coordination agencies, hospitals, clinics. I'm really just trying to pull our rural folks together to find ways to support and learn with each other, and also kind of give you a straight line to HCPF if you have questions. And so I just want to share a little bit, if we could go to the next slide, please. Just give you a little bit of history about this project. And so this project was actually born out of the American Rescue Plan Act, which we call ARPA. It was ARPA Project 110, Rural Sustainability and Investments, and that was really broken down into two individual phases. The first phase, we actually worked with a vendor to create a dynamic heat mapping tool. And what this heat map tool does is it allows us to track providers, the member to provider ratio across the state. So we can actually kind of hone in and see maybe where there are care deserts, where maybe there's a handful of members and not very many providers, or a handful of members and maybe no providers for a certain specialty or waiver service, or what have you. And so we're able to really kind of identify those hotspots where care deserts may exist and really push some resources into that and find ways to support folks in that area. So we're excited to have that map live. I'm going to drop some links in the chat just kind of as we go through here. So the first one is going to be really information about ARPA as a whole and a list of all the projects that we had. And I'll make sure I send these over to the team as well with Samantha, and maybe she can make sure that you all get access to these links afterwards as well. But she posts the slides. All these are hyperlinked as well, and the lives are active. And so she should have access to all of those. But the first two is that ARPA homepage with an overview of all the projects, and then the heat map dashboard, which actually serves two purposes. It also houses kind of the Rural Provider Sustainability Community of Practice website too. So all that great information rolled up onto that one website. So phase one was that wonderful heat map that we have. And then phase two was really a recommendations report. And what we asked the vendor specifically for was to take the information from the map and pair that with things maybe other state agencies are doing, other states across the nation are doing, other types of coordinated efforts, maybe in education, and really look and see what we could do to support our rural providers in long-term services and support. So across the gamut of home and community-based services, our skilled nursing facilities, our PACE providers, we really wanted to focus resources into that group specifically in LTSS. So they came back with a recommendations report for us and really focused in on shared resources. So sharing resources across different agencies, providers, rural community folk, And so we looked at workforce, so shared staffing models, training programs, administrative support and oversight, and then supplies and equipment. And so they really broke it down into that report. And what I'll do is I'll drop a link to that report in the chat right now if you need some light reading to take a peek at that at any point as well. But it really digs into kind of what we asked of them and what their recommendations were. And what their recommendations were was talk to your providers, get out there, start speaking with people, start seeing what is available, what skills are out there, and really bringing folks together. So folks in the Southwest corner maybe don't talk so much to the Northeast corner, but are they doing things that are similar? Do they have barriers that are similar? And how can we bring them together and get them in the same room so they can share and learn? And then also have a direct line with HCPF where we can share resources, much like you all do here in this office hours as well. So we're doing that in a time and a space. And if we can go to the next slide, please. We have quarterly communities of practice. We went through the recommendations report with folks. We did listening sessions. We heard barriers that they might have. We heard, we can implement this. No, we can't implement this. And we wanted to continue that conversation. And so that conversation continues in these quarterly communities of practice. And this is really an opportunity for those LTSS providers, like I said, the SNFs, the PACE providers, HCBS providers. And we also welcome care coordination agencies, advocates, rural and hospital staff or clinic and hospital staff. We want everyone that has a hand in this getting folks services in rural areas to come together to learn, to share and network with each other, and then to network with us as well here at HCPF. So these are all stakeholder-led agendas, and we do that through our topic request form. And so what we want is folks to say, hey, this is how we want to spend our hour every quarter. We here at the department are happy to front load some agenda items, but unless we hear from you that this is what you actually want to hear, we don't know if it's useful or not. And so we really like to have a topic request form ahead of time. I think much like you all do here, where you have requests and then the department goes back and tries to get those topics for you in future meetings. So we do something very similar. And so I dropped the topic request form there for December, and I actually think perhaps on the next slide, Samantha, I might have this as well. Brought forward by our stakeholders in our September meeting was, hey, we'd like to have somebody from the department case management team come and chat with us about the roles and responsibilities, what individual people are doing in these areas, what is the case management agency doing, what are case managers doing, how does that relate to transition staff and folks that are already in the community receiving services. And so what we've done is we've collected a handful of questions from our stakeholders who were in that meeting. And we're going to put that to the case management team in December and have them come and chat with us. And so that next meeting is Monday, December 8th at 1 o'clock. We do have them on Mondays, which is kind of a strange time to have meetings, I know, but that was just kind of the consensus of the group when everybody was available. But we do post those recordings and the slides to the website if you're not able to join us in real time. And you're welcome to just pop in. We don't expect folks to be able to stay for the full time always. You can come to one meeting and then wait 6 months and come to another. There's no consistency that's required to attend these meetings. We just ask that you have an interest and you show up and you want to learn. So we'd love to have you. We're kind of building folks out right now. The attendance has really been focused on intellectual disability providers, IDD providers. We do have some aging and disability providers, but we're welcoming folks from all areas to join these meetings. We really want it to be across the continuum of care because we know, especially in our rural communities, folks are wearing a lot of different hats and you're talking to the same people, regardless of if you're working with youth or you're working with adults or what population you're working with. It's usually the same folks that you're talking to pretty consistently in these small areas. So we want to welcome as many folks to the table. And we're excited just to have it all kind of kick off. This will only be our second meeting in December. September was our first. And yeah, we're just excited to see how this builds out. It's very iterative. It'll really depend on those topic request forms that folks are having. I work on the workforce team, and so we'll always kind of have a pulse on what's happening with workforce development and recruitment and retention. But yeah, we would love to see you. I'd love if there's anything that you'd like to see in future meetings. If you want to sidestep that topic request form, I'd be happy to take chat recommendations as well for future topics. But and I've also included here, if you have workforce interests, I didn't talk about it specifically, but that is our team. So we do have a website for workforce interests as well, if you'd like to check that out as well. So I will drop my email address as well as the workforce interest in the chat. And I think, Samantha, that might be my last slide. So I flew through that pretty quickly. I had another presentation yesterday that was much, much longer, but I think I tended to bore people a little bit. So are there any questions or anything I can answer for you right now?
Thank you, Brooke. And just to clarify, I thought you said skilled nursing facility staff can attend that community of practice, right?
Absolutely. Absolutely. Yes, we would love to. Right now, we haven't had anybody from that space yet, but we would love to welcome them because again, it's all connected in rural areas. I mean, it's so close to connected, and so we'd love to have folks join, and we'd love to have topics specific to this group as well.
Awesome. And then I did have a question. So this heat map, I saw the link that you put in there, and then we will also send an email out with those links and put them on our website for this meeting. But I was just curious, how often is that updated with rural
Yes.
resources?
Yes, great question. And so the heat map itself is updated with the previous year's claims data. And so we do yearly updates. So we'll start our next update in April. That's when 2025 claims data becomes available. One caveat I do have with it is it's not a standalone tool. It needs to be used in tandem with like a find a doctor tool. Because what it does is it gives us the numbers, but it doesn't give us the names of the providers in those areas. So we can say, hey, here's a care desert. But we can't say, oh, there's 3 providers in that area. Let me see who those are. We have to use it in pair with another, the Find a Doctor tool to do that. So it's not a standalone. It really just breaks down the numbers for us. But I think for like year over year data to be able to say, okay, what we're doing is working or what we're doing is not working. We see more care deserts or less. It's been helpful for that. All that to say, we update it yearly.
Perfect. Thank you. I do appreciate that very thorough answer because it's good to know that you have to pair it with find a provider. And
Yeah,
then I haven't looked at it myself, but are behavioral health specialists listed on there as well?
I believe so. Yeah, we have different inputs. Let me look. I have it pulled up here. I'm so sorry. It's like, I want to be slow today. I promise it's a good tool. I just maybe don't know how to navigate it that well.
No, you're
I,
fine. Just because
I'm,
I know that's come up a lot in our conversations with residents at skilled nursing facilities and the social services directors as well, is that most rural areas are behavioral health deserts. So I was just
yeah.
curious.
You know what, Samantha, I will look and see. And if it's not on this map specifically, I'll go back to where we pulled information on the care deserts in the report and send that to you as a reference for where to find that information. So we'll make sure you all get that.
Perfect. And then I did see a chat question saying, how do we register for that meeting?
Oh, goodness. Well, you can email me. Um, I can get you added to the invite. You can also access it through the Office of Community Living's stakeholder engagement page calendar. So it's up to you. If you want to put it on have it on your calendar every month and not have to go to the calendar page every time, you can email me and I'll add you to it. Otherwise, you can just visit the stakeholder engagement OCL calendar to access it on the day of. So it's just kind of how you'd prefer, Kim, to be alerted to those meetings, but I'd be happy to add you with just a quick email.
Thank you, Brooke. And then we'll pause for another minute just in case there's other questions. So I don't see anything in the chat. I was looking again to make sure I didn't miss anything.
And I
Oh,
see Kim's email there. So Kim, I will get you added. Thank you so much. You'll see an email from me very shortly.
awesome. Well, thank you, Brooke. I definitely appreciate it. And we will keep in touch because I know this is a very important topic for the entire state, but mostly the rural communities, just because there are care deserts, unfortunately. So we will stay connected to provide different updates. And I definitely appreciate your time.
Absolutely. Thanks so much, all. We'll talk to you. I'll hang on for a little bit just in case there's more questions, but yeah, thank you so much.
Awesome. Thanks, Brooke. Awesome. So there again is her contact information. If anyone needs it, I will stay on the screen briefly. And I know she put it in the chat as well. Perfect. And then we will go ahead and talk about transition services. I know last month we had Jay Jackson talk about just the general overview of transition services and TCMTC, targeted case management, transition coordination. And so I'm glad to have Janelle Polier, the expert of transition services, here with us today to talk about those benefits for those transitioning from skilled nursing into the community. So Janelle, take it away.
Will do. Thank you so much. Can you hear me okay? Great. All right. Well, I really appreciate you inviting me here this afternoon. It's an exciting topic. Maybe I just feel that way because these are the benefits I get to oversee. But there are a lot of exciting changes happening with these services. So I'll sort of go broad and then I'll sort of work in a little bit deeper about what these changes are and what members might be affected, who's eligible, and those types of things. So next slide, please. All right, so what are transition services? I'm sure most of you know these are services that are designed to help members who are transitioning into the community from an institutional setting to a more independent setting or a community-based home. And this provides those supports just to help ensure member success that they'll be able to maintain that situation. So next slide, please. All right, so who qualifies or what qualifies as a transition into the community? This can be a number of situations. So we know that this can be a SNF moving to an independent home or a group home, but this can also be somebody who's moving from a family home into an independent home. Somebody who's in assisted living, and again, also moving into an independent home. So it's basically going to be a steps down situation from a more restrictive setting to a less restrictive setting. Next slide, please. And so what are these transition services? So transition services moved from the Colorado Choice Transitions or a CCT demonstration program. And in 2019, these were all incorporated into HCBS services. These services were available on all 6 waivers to some degree. There was a few differences between the waivers, but these were all available for these members who qualified moving from institutional care to more independent living situation. Those services were life skills training, which were skills to help folks sustain themselves in the community, peer mentorship, which is shared experiences from somebody else who's had these lived experiences transitioning into the community, home delivered meals. I think a lot of folks are pretty familiar with that. And then also transition setup or reimbursement for expenses associated with setting up a household. And I'll go a little deeper into these services. So let's go to the next slide. So life skills training. So what is this? So life skills training means individualized training that's designed between a member's case manager and themselves to determine what's needed in their own individual situation to ensure that success within the community. And this can be any number of skills trainings. This can be self-care, activities of daily living, time management, household management, medication management, problem solving, communication skills building. It can run the gamut. So this can be any number of skills that agency can help that member to just boost their confidence and then boost their ability to maintain a healthy relationship and living situation within the community. Let's go ahead and go to the next slide. So peer mentorship. This is a pretty exciting, frankly, an underutilized benefit. We've been working really hard to boost utilization of the services by going out and educating folks on what it is. So it's support that's provided by peers, and it promotes their self-advocacy and encourages community living among members by just providing advice on issues. This is less life skills training and more just, hey, this is what I experienced when I went into the community, and sharing that with this member to give them more of a, I guess, more of a personal experience, just to help them deal with those real world transition experiences that they may have. So this can be things like promoting interaction with friends and companions of choice. One of the examples that came up within a work group recently, a provider mentioned that a member had transitioned into independent apartment living, and they were having a really difficult time reaching out to their neighbors, getting to meet their neighbors. And so this was one of those things that their peer mentor walked them through the steps just to become comfortable with that, to reach out to their neighbors. Sometimes it's successful, sometimes it's not, but also, again, just kind of promotes that confidence and their ability to maintain that independence. Also, problem solving issues, awareness of opportunities, could be volunteer situations within their community, even sitting on boards within their community, just getting them involved, just integrating folks. So community acclimation and integration techniques, how to do that, and also to assist with interviewing any of their potential providers. Who do they want? How do they select a home delivered meals provider? Something like that. So again, those not skills training, but I guess just those experiences come from somebody who's already been through that situation. All right, next slide, please. Home delivered meals. So home delivered meals obviously is meals that are delivered to a member who doesn't have access to meals or resources. They also may have the inability to prepare their own meals. They may have specific dietary situations that they're currently unable to manage in terms of providing a heart healthy diet for themselves or managing a diabetic friendly diet. So this is a way for them to obtain meals for up to 365 days. They can access up to 2 meals per day. And this, again, just helps them stay healthy, help keep them in their community, provides that nutrition that they need. Currently, we have I think we have about 13 enrolled meals providers. We have a couple of local providers, but most of these are providers that are coming from out of state or delivering from out of state, and they provide shelf stable or frozen meals. Right now, we're working on enrolling providers who are more local, who may have the ability to provide hot meals, which seems to be a very exciting change, and it looks like we're really moving towards that. I'm trying to think what else is important about this service. Oh, I'll get to that. Right now, it's currently, well, it was an HCBS service, but it's one that rolled into CFC, but I'll talk a little bit more about that just momentarily. All right, next slide, please. So transition setup. Transition setup, this is also a service that moved from HCBS into CFC, and this allows a member to, well, they're not specifically reimbursed the expenses, but they have $2,000 in reimbursable expenses to purchase one-time items to set up a home. And this can be pantry items, this can be linens, this can be their kitchen setup, forks and knives, furniture. It cannot be things that are used specifically for recreation. So this can't be TVs or gaming devices, but it does allow quite a bit in terms of funds that can be expanded up to $2,500 with department approval. And again, these are items to ensure that they have everything they need to remain healthy and safe within their home. Some of these expenses can also include security deposits and application fees. Setup fees or deposits to access basic utilities or services. It does not cover ongoing utilities bills, so it's just for that one time. Essential household furnishings, as was mentioned, and then services necessary for the individual's health. So this could be something like, a fumigation of a property that may need it, or a one-time cleaning prior to them occupying the space. It cannot include other items that would be covered under Medicaid, so it can't be grab bars. There would be another avenue for members to access those services or those benefits. All right, next slide, please. All right, so how does a member access these services? Let's go on to the next slide. So previously, as I mentioned, all four of those services were accessed through HCBS waivers, through adult waivers. And two of those services, transition setup and home delivered meals, have moved over to CFC. I'll go a little bit further in depth on that shortly. But life skills training and peer mentorship are still available through HCBS. And what this means is that a member who's transitioning, say, from SNF, they do need to, in order to access the service, they do need to be enrolled for that waiver. In some circumstances, they can begin receiving those services prior to enrollment. Um, what what this comes down to is this would be a member who's providing those services in good faith in anticipation of that member completing enrollment, and then they would be reimbursed. There are some situations where a member, either due to changing their mind, they don't want to enroll for a waiver. We've actually had some members who've passed away prior to their enrollment being complete. So if they have received services, have not fully enrolled, those providers actually have no way to be reimbursed for those services. We do have a few providers that are willing to do that. And they sort of do that, as I said, sort of in good faith, at their own, I hate to say at their own risk, but they do anticipate that those members would be transitioning into the community and enrolling on a waiver. All right, next slide, please. So community first choice. This is probably one of our most exciting developments as far as I'm concerned for these services. So as of July 1st of this year, two of our services, home delivered meals and transition setup, moved from HCBS and became accessible to a wider Medicaid population. And those would be members who have been assessed as qualifying for long-term supports and services. And so this just gives these members who may not qualify for a waiver access to these services. Again, home delivered meals can be accessed for up to 365 days. It can be due to a transition, but it may also help a member who meets those other eligibility criteria. They don't have access or resources to meals. They are currently in a position that they don't have the ability to provide those meals for themselves. They may have some medically needed or dietary restrictions that require, I guess they can obtain this through the home delivered meals provider. So they wouldn't have any other way to meet those needs and stay healthy. Transition setup also is now available for folks transitioning into the community. And this service needs to be utilized within 30 days of one's transition. And along with those setup funds, the agency providers also are reimbursed for that transition coordination piece. So while they're helping members find those items, those household items, to go shopping, to implement them or help move them to their homes, the time they spend on the phone to help coordinate obtaining that lease, there's also a reimbursement mechanism within that service as well. All right, next slide, please. Okay, so these are an overview of the transition providers. So these include those providers that help guide these members into these services. So options counselors would really be the first stop for individuals who are currently in an institutional setting. So they would reach out to the options counselor who would connect them to the additional community resources. This would be also the transition coordinators, which would help facilitate that move, reach out to case management, help them connect with those services or find out what they're actually going to be eligible for. And then, of course, we have the HCBS CFC case managers. They're the ones that will administer the assessment to determine that the member does qualify for those services. And just to clarify, a member can qualify for both HCBS and CFC. So they can access both of those. They're not mutually exclusive. And then transition services providers. And those providers can be found on our Find a Doctor app. But you can also reach out to, or the member can also reach out to the case manager to help them locate a provider within their specific area. A couple of the things I wanted to mention about more rural situations or those who live in more rural areas. Peer mentorship can be administered via video. So virtual is a reimbursable expense for that service. And then also our home delivered meals providers, most of them cover all 64 counties within the state. And as mentioned, we are working on enrolling other providers that can possibly provide hot meals. And those providers actually happen to be in our more rural counties. So hopefully we'll see some additions within the next few months. So the members would have access to that. All right, next slide, please. All right, does anybody have any questions so far? Kind of peeking in the chat. I don't know if I see any yet.
I haven't seen anything in the chat either.
All right.
We can have people come off mute if they have any questions.
Right. Well, not hearing any so far. I'm pretty accessible. And of course, I'll have my contact information on here. So let's go ahead and get to the next slide. And these are just some resources that are very helpful. The transition services, this will provide just those eligibility criteria and then also access to those different services that are available to members. The link to our department rules and regs, which I think probably everybody has. Also the home and community-based services waivers, and this will go into more detail about those services that are available under HCBS. And then community first choice, or CFC. There's a fantastic FAQ, if you haven't seen it, that talks about directing people to these services. And for the transition services, this again would be the home delivered meals and the transition setup. But it's a pretty comprehensive page. It answers just nearly every question that you might have about that service. And then I think my final slide is just my contact information. So please do not hesitate to reach out to me if you have any questions about this or just need to know, who to connect somebody with to get the ball rolling if they think they might be eligible or are interested in any of these services. And that is what I had for you today.
Awesome. Thanks, Janelle. And then I did just want to mention specifically when we're going out doing group and reach with members, and I'm sure a lot of our local contact agencies on the meeting can attest to this as well. When we mention transition setup services, like their eyes light up like, oh, that's a possibility. We're like, yeah, so we can definitely help provide that to an extent. I mean, there's limitations, but it's exciting to see what all is possible using transition services.
They're really great wraparound services. And as I mentioned, a couple are fairly underutilized, and I think it may just be due to the fact, maybe a lack of understanding or what it means now that it's going into CFC. So we're doing all we can to get the word out, provide some education, and then just make ourselves available for any questions or guidance. So thank you so much.
Thank you. And yeah, we're definitely excited to see some of those move under CFC to expand how many people are eligible. Definitely moving in the right direction with that. But thank you, Janelle, for coming. We definitely appreciate your time. Awesome. So we will go ahead and move on to, I did want to just mention real fast before we talk about future topics, because I know fiscal environment regarding Medicaid in general has been a hot topic. Before we talk about this website that is available for everyone to use, if you haven't already, please put your name, title, and the agency that you're with into the chat, just so we can just keep track of who's in attendance. But I know, especially this week and in the past month, there's been a ton of questions around the fiscal stability of the government, especially with the government shutdown. Thankfully, that has officially ended. But with different public assistance cuts or pauses to other programs, I know this is a huge concern. So we just wanted to highlight that there is a website available, and we'll put the link to that into the chat, just to give you guys more resources on the Medicaid sustainability and Colorado's LTSS system, because I know that is also a really important topic, because that does include some of the things we were talking about earlier today. LTSS being long-term services and supports, mostly under those HCPF, home and community-based services, but also some services provided in nursing facilities. So just wanted to mention that this is available for you guys to go to. But Colorado's long-term services and supports LTSS system plays a critical role in ensuring that older adults and individuals with disabilities have access to care in the setting of their choice, whether that's institutionalization, such as skilled nursing facility, or in the community. Over the past several years, the state has invested over $600 million to expand access, improve equity, and strengthen the direct care workforce, as we learned more about today. Investments into the LCSS infrastructure to support a strong workforce and large provider network will help ensure a solid system for years to come. However, ongoing fiscal constraints, including new federal mandates and limits on state revenue growth, require the Department of Healthcare Policy and Financing, HCPF, to reassess and align its policies to ensure long-term sustainability. Our commitment at HCPF and Office of Community Living, where a lot of these programs live, remains committed to transparency, accountability, and partnership throughout this process. Sustainability is not a one-time goal, but an ongoing responsibility to the individual served by the Medicaid program and to providers who deliver the care. So we just wanted to make sure that this website is available for you guys. The website has a ton of resources on it, which is awesome. It talks about the current fiscal environment at both the federal and state level, but then also how to stay connected, how to stay informed, because there have been some changes in the past year. So this definitely gets you connected, along with that OCL stakeholder engagement calendar that Brooke put into the chat earlier during this meeting. That is a really good resource that I personally use as well. But this will give you other resources on how to stay connected. And then also, what actions are HCPF, the department, taking to improve sustainability throughout the state and for Medicaid program in general. So just wanted to make sure that this is available to you guys. Just a screenshot of the website in case you wanted it. And then future topics. So in December, we have rapid reintegration update, because we were really excited for that to roll out in January of 2026. And then I will provide an update on individual inReach. And then we have two agency spotlights, the Action Network and then Elder Care Locator, which is really exciting. And then in January, we'll talk about some really positive updates to the respite coverage under Colorado's Medicaid program. And then we'll also have a member case study, so you guys can see one of our successful stories from someone who was in a skilled nursing facility to someone who's currently successfully living in the community. So we're excited to do that. And then also, speaking of meals that Janelle was talking about, we have another agency spotlight, Mom's Meals, who will hopefully be able to present in January. Future topics. So we have some future topics. Definitely feel free to put other topics that you guys would like to talk about or learn more about into the chat. We will definitely love any any input that you guys have, because this is your meeting. So we want to make sure we cater to you, especially at the skilled nursing facility, to make sure we're able to partner with you guys in case you guys have any concerns, questions. We just want to hear more from you. So these are our future topics. And then contact information, I have myself and Susie at the top. Our emails, in case you guys need anything, we are the main contacts for group and individual inReach. And then our director, Jill, who is the director of our SID team, Compliance and Innovation Division Director, Matt Bohannon, who oversees the transition coordination agencies, and the access unit supervisor, and then just our team emails in case you guys need those as well. But I will definitely pause in case anyone has any questions. But if not, feel free to enjoy the rest of your afternoon, and thank you guys so much for attending. I appreciate it. Have a good day.